Now, the time is 7:10, and our top story this morning is that the government has revealed that people over 70 and those with health problems will be asked to stay at home for up to 4 months to shield themselves from the virus. Not now, but in the coming weeks, we are told. The Health Secretary initially made the announcement in the Telegraph newspaper in an article hidden behind a paywall, but in response, government will now give daily briefings on TV to keep the public updated on the escalating situation. This is what the Health Secretary had to say about the issue on the BBC's Andrew Marr show yesterday morning.
There's been a lot of talk that quite soon anybody over the age of 70 is going to be asked to stay inside their house for up to 4 months. Is that a realistic thing to ask to do?
Well, the protection of the vulnerable and elderly by asking them to stay at home, that is in our action plan, but we do not want formally to say yet that people should do that. And the reason for that is simply this length of time that they'd need to stay self-isolated, stay at home to protect themselves is a very big ask. It's a very long time. And we do know that if you ask people to do this sort of thing, then they can tire of it. We know that it has negative impacts.
Millions and millions and millions of us are going to have to stay inside our houses for 4 months or so. Can I ask you, how long before you actually say that this now has to happen?
Well, that'll be in the coming weeks. And getting this...
Next week, possibly?
I'm not going to go into any more detail on the timings because we want to be ready to say that when we judge, based on the scientific advice, that the time has come.
There will be an awful lot of people watching this programme wondering, should I go and visit my elderly relatives, my parents or whatever, my grandparents? A lot of carers wondering, for how long can I go and visit these people in this house? What's your advice to them? Because they can't wait forever. They need to know what to do.
Well, our advice very clearly is that if you have a symptom, no matter how mild, then you must stay at home, both to protect yourself, but also to protect others.
The Health Secretary, Matt Hancock, speaking on the Andrew Marr show yesterday. Well, already there has been a lot of reaction. Liz from Brighton gave us a call a bit earlier.
I feel absolutely terrified, to be honest. I'm terrified.
And I think people like Liz echo the sentiment of so many. I have to say that I haven't seen a reaction like this. I mean, in the first hour of the programme, we have had dozens of calls, texts and emails on this particular topic. A couple here, Anon in Pagham. This is aimed at people who are over 70 and have a health problem. I will be ignoring the instructions, says this person. Another one here, Mary in Haywards Heath. Morning, Mark. It'd be nice if people could cheer up and keep the British going. The spirit which helped us through the last war. Everyone pulled together, helped each other, worked for the good of country and thought of innovative ways to survive. Let's try and be positive. Mark says, good morning to you. Good to know that Barbara, one of your earlier callers, thinks her dog is more important than the good of society. Old people often moan about the young being selfish, but people like Barbara need to listen to herself and realise just how self-centred she sounds. That's from Mark. What do you think on this? Do let me know your view this morning. Ruth Isden is from the charity Age UK and says the plan could be very difficult effectively to roll out.
It presents a number of challenges. So obviously very practical ones about making sure that people have what they need to maintain their health and well-being at home, food, medication. It's about supporting people to stay active as well, because the last thing we want people to do if they are at home for a long period of time is to become immobile, as well as if they become more lonely and isolated, which is often a difficulty that many older people experience.
Now, interestingly, in Scotland, they will not enforce such a measure, as things stand at any rate. They say visitors will still be allowed, but must stay 2 metres away. Here's the Chief Medical Officer of Scotland, Dr Catherine Calderwood.
We would ask the over 70s to reduce their social contacts by about 75%. That will mean, though, that they probably will increase their family contacts or close friend contacts who would be able to bring them food and also prescriptions if they needed that, take them to hospital appointments.
Tony Stein, then, is the CEO of Healthcare Management Solutions that runs 80 care homes around the UK, including the Patcham Nursing Home in Brighton. And he's on the line now. Good morning, Tony.
Morning, Mark.
Gosh, this must present some real difficulties for your teams.
Yeah, it's unprecedented times, but I love to hear the fact that you're not panicking and you're not stirring the hype. The big issue, I think, about the news about the over 75s really is that we're all trying to work out how best to delay the transmission of the disease. And clearly, isolation or keeping yourself away from other potentially infected individuals is the way to go. But I've always said that I think common sense tends to win the day here. So giving a blanket ban on everybody to stay at home and self-isolate for 4 months sounds terrible, because it sounds like you're going to be effectively on your own and have no contact. But the reality is that there are many ways that you can reduce that contact without taking the extreme measure. So my mother, for example, I know that if I'm completely clean, I've had a shower, I've changed my clothes, I've washed my hands, I get in the car and I go directly to her house, the chances of me transmitting the disease to her are limited. That's not to say that I'm not a carrier, but obviously when I get there, you've just got to be sensible again, wash your hands and stay somewhat distant, maybe a bit more distant than you might normally be. So I think the problem is that the government's giving it advice, and actually that advice sounds quite draconian, and actually it's the extreme measure that they're talking about. There's a lot of things that we can all do to reduce those risks in the intervening period by just reducing some of the things that we historically might have done.
We want to keep everybody safe. That's the key message. However, I guess what we all need is some form of human contact. And if you're spending time in a care home, or indeed if you're in an apartment and you're on your own most of the week, that little bit of human contact that you get is so important in your life, isn't it?
Oh, absolutely. But I think things are slightly different for those in a care home, because clearly they're probably one of 30 or 40 or even more people. So they've got that contact. And obviously there's also the staff around. If you're on your own at home, then it gets even more difficult and more challenging. And I think in those situations, we just need to work out how best we can maintain that contact, but again, reduce the risk. So minimise the number of different people coming in, make sure that those that are coming in understand the need for good personal hygiene and distance, and try and keep in touch with people through social media, through maybe if you've got an Alexa show or something where you can actually see people and talk to them, or Skype or similar kinds of digital means, that would be very helpful too. I think it's really important as well that as a community we now start to think slightly differently. If you know of an elderly person who is on their own, they may well be very, very frightened. And I think the answer is just to try and keep in touch, even if it's just to knock on the window and wave and have a chat. That's the sort of thing that we should be doing.
Excellent. Good advice. Thank you for your time this morning. That is Tony Stein, CEO of Healthcare Management Solutions, who run 80 care homes around the UK.